agitated. Now she's a little agitated.
Yeah.
Seeing children in pain is one of the worst things I think that any of us can experience. You can see how much she's calm just from touching this one point.
The STAD Center is a transdisciplinary group that has 3 main arms: pain, palliative, and integrative medicine, all of which work together to really think about the patient in a holistic way.
It really has changed the way that we're able to care for patients at UCSF. But we really couldn't have done it without Elisa and Mark Stad. Their generous funding has really allowed us to grow our program.
My dad's American, my mom is Chinese. And I felt like that really connected with my passion around this Eastern and Western medicine in a hospital environment. As a child, I lived in and out of hospitals. And then I had the experience of being a mother with a sick child, and he had to go in for surgery. I had to hold my breath for several hours and not know if he was gonna wake up from the surgery. It made me go back and feel how my parents felt when I was a sick child and realizing, wow, there's something here. We've got to give more tools to families so they can feel that they have control of the situation. And that's how I started getting involved in UCSF.
We have 3 divisions that provide care over 2 campuses. The pain team provides pain support for cases where pain management is going to be more challenging.
Dr. Friedrichsdorf is an internationally known leader in pain and palliative care.
Hello, hello. Wheels on the bus go.
And so to have him here leading our program is incredible.
If I ask every single child, what are you most afraid of seeing a doctor tomorrow? It's the needle pokes. The way medical assistants, nurses, doctors were falsely trained is that you have to hold down the children and sort of do it quickly. This is utterly complete nonsense. Only now do we know that those kids get traumatized and they may become afraid of doctors. They're more likely to be ill because of unrelieved pain when they're very sick as babies.
This looks good.
So what we're doing here is our comfort promise. We promise to do everything possible to prevent and treat pain. And when we talk about needle pokes, you put the numbing cream on. If it's a baby, we either offer some breastfeeding or a drop of sugar water. The baby's swaddled. Now pretty much all of them are sleeping through the intervention.
Dr. Friedrichsdorf has this whole way that he interacts with patients that, he kind of draws them in, and he brings a lot of humor to what he does.
Many of the patients have like a red light on the finger, the foot, right? We're measuring the oxygen. Then I steal the red light, put this sort of into my ear, can take it out from the one side to the other. You sort of toss it around, can sort of... That gives you a lot of street cred. So look at the space between your fingers, and when... So I'm a pain specialist, don't get me wrong. Take a nice gentle breath in and out. If I have open heart surgery, I want really good pain medication. And we have learned that at the same time that the best care we can provide is if we combine state-of-the-art Western medicine with integrative non-pharmacologic modalities.
The Integrative Medicine Service provides non-pharmacologic pain management, symptom management, and quality of life improvement. While we're seeing the integration of Chinese medicine and acupuncture more broadly, take a nice breath in. It's still a bit of an anomaly. And exhale, and a little pinch, which should go away in just a second.
I have chronic migraine. The overall relaxation and calmness that this treatment brings is amazing.
It seems so counterintuitive to think that kids would choose to have a therapy that involves needles. And yet this is a therapy that children love. They go, wow, that felt interesting. Or if that little needle just popped my pain bubble and now it's gone. Usually after the first treatment, kids will say, can you come back every day? So the demand continues to grow because it works so well and because it also helps improve outcomes. Is that good? Okay.
We do know that when patients receive integrative therapies, they're able to peel off medications that are causing adverse side effects, and that increases their state of well-being, increases their quality of life.
The palliative team provides care for chronic, serious, life-limiting, or end-of-life care.
Palliative care to me is the heart of what it means to be a physician. To really see and support a patient and their family from a holistic lens. To be able to support the body through symptom management, and to be able to support on the emotional and the spiritual front as well.
Let's take a big sniff.
Right now, delivering integrative medicine is challenging because insurance doesn't pay for it. So the fact that the center provides these services to our patients here, that is a really special thing that's happening at UCSF that is not happening in many places.
With every breath, you become more relaxed. That's it.
I think we can really, within the next 2 to 5 years, spectacularly change the way we provide care to children.
How's that, Jade? Okay? We want to create protocols and treatment methods that could be replicated at every pediatric hospital in this country or beyond.
He's now off of...
We hope to have wide-reaching impact to improve care. What we're doing is not just changing how kids are receiving care and their outcomes in this moment, we're trying to set them up for a better life for as long as they live.